Hi everyone! Thank you for listening today as I go over eating patterns for depression. Just as a disclaimer, this presentation is not intended to replace the help or advice of a qualified medical care professional, but rather to provide recommendations to ways you can improve your diet that may aid in depression symptoms. So why is it important to address mental health? Mental illness is a leading cause of disability worldwide, and depression predicts the risk of other chronic illnesses such as cardiovascular disease, diabetes, epilepsy, stroke, Alzheimer's, dementia, and cancer. Depression is highly associated with obesity, metabolic syndrome, and type 2 diabetes. There's consistent evidence supporting that diet affects common mental disorders. There are certain hormones, neurotransmitters, and inflammatory markers that are associated with both nutrition and depression. Hormones and neurotransmitters are chemical messengers that are released within the body to help regulate certain functions. Elevated inflammatory markers indicate inflammation or infection in the body and are associated with possible disease. This slide lists some of those associated with nutrition and depression. Cholecystokinin is released during digestion of protein and fat, and it can induce panic attacks and increase stress hormones. Gastrin-releasing peptide stimulates the secretion of gastric juice, and it can regulate anxious and depressive behavior. Neuropeptide Y stimulates stress response, food intake, sleep, and inflammatory stress, plays a role in the pathology of both depression and anxiety. Brain-derived neurotropic factor mediates food intake via the reward-related behavior. Ghrelin regulates central system development and mood. Ghrelin administration appeared to have antidepressant-like effects in men, and intake of carbohydrates increase ghrelin release. Leptin, certain nutrients can induce leptin resistance. This leads to depressive symptoms, sleep disturbances, reward seeking, and increased food intake with weight gain. This influences mood as well as the response to psychiatric medications. So what dietary changes can you make to improve the regulation of hormones, neurotransmitters, and inflammatory markers? Here are some dietary considerations for the management of depression. So make sure you're getting adequate amounts of zinc, magnesium, folate to reduce the risk of depression. Improvements in mood by increasing zinc, magnesium, and folate seem to be best when higher intakes are achieved through food rather than supplementation. For zinc, those who have alcohol dependence, gut disorders, pregnancy, and sickle cell disease have increased zinc needs. So here are the RDAs for zinc. Over the age of 19 is 11 milligrams for men and 8 milligrams for women. Pregnancy is 11 milligrams. Lactation is 12 milligrams. The best sources of zinc include beef, poultry, dairy, whole grains, nuts and seeds, beans, and peas. Magnesium. Almost 50% of Americans don't consume the RDA for magnesium. Magnesium levels tend to be lower in patients with severe major depression, schizophrenia, and heroin addiction. Depression is an inflammatory condition, and magnesium is a powerful anti-inflammatory mineral. The RDA for ages 19 to 50 is 400 milligrams for men and 310 milligrams for women. Pregnancy is 350 milligrams and lactation is 310 milligrams. The best sources include nuts and seeds like almonds and cashews, spinach, whole grains, beans, and yogurt. Alcohol dependency, pregnancy, gut disorders, and the MTHFR polymorphism can lead to folate deficiency. Higher folate intake is associated with lower homocysteine levels And so elevated homocysteine levels have consistently been linked to major depressive disorder. The RDA for 19 to 50 is 600 milligrams for men and women, and 600 milligrams for pregnancy. Lactation is 500 milligrams. Good sources of folate include beef liver, spinach, beans, asparagus, and fortified cereals. There are some other dietary sources to consider which have been linked to depression, for instance, omega-3 fatty acids. Research has shown that 20 milligrams of fluoxetine, a well-known antidepressant medication, and 1,000 milligrams of EPA appear to be equally effective in the treatment of major depressive disorder when given alone. However, a combination of both was superior to either one alone. Best sources of omega-3 fatty acids are shellfish, fish such as herring, farm salmon, and sardines. Algae-based supplements may be used for vegetarians. Vitamin D has also been a popular topic in literature, and low serum vitamin D levels are significantly associated with higher levels of depression symptoms or with depression diagnosis. The RDA for vitamin D is 15 micrograms for children and adults ages 9 to 70. More specifically, there are some food sources that have been researched, and this is what the research shows. There's a positive association between the consumption of sweet food and beverages and common mental disorders in men and recurrent depression in women. So try avoiding added sugar, and this is definitely something to consider. High intakes of green leafy vegetables are associated with a lower odds ratio of depression. Berries are inversely associated with depression, and consumption of red meat may be associated with a moderately higher risk of depression. So if you're struggling with depressive symptoms or have been diagnosed with depression, here are some steps you might want to consider taking. First, talk to a healthcare provider if you're concerned about a possible nutrient deficiency before taking supplementation. Remember, it's always best to get nutrients from direct food sources rather than supplementation, unless there is a severe deficiency. Improve diet to meet standard recommendations, so 7 to 9 servings of fruits and vegetables per day. Switch to whole grains and avoid fried and fatty meats. If you need additional help, seek the advice of a registered dietitian to help adopt healthier eating patterns. Thank you again for listening today, and please consider filling out the form attached to this post to give feedback about today's presentation.